Okay. Hi, this is Dr. Reuben Chen. I'm here with Dr. Kartik Ananth, and we're here at Pacific Pain and Wellness. We want to talk a little bit about some things that we can do right now, especially as people are locked down. Now, one thing that's very special here is that Dr. Ananth is a board-certified pain physician and he's a board-certified psychiatrist. So I know that especially right now as people are locked down, mood and pain are probably two things that are being affected greatly. First of all, Dr. Ananth, so how is pain and mood connected?
Well, anytime you have pain, it affects the whole cycle of everything, including sleeping, your diet, your exercise, your movement. So if you can't sleep, your mood is going to be affected. If your mood's getting affected, then it's going to be difficult to sleep. If you can't sleep, you also have increased pain. And if you have increased pain, then you can't sleep. So mood is on a continuous cycle with all the other factors that involve pain as well, and nutrition.
So does that mean that if somebody is having pain, it may be actually mood related and vice versa?
Yes and no. The only thing that we can say, for example, is if you have pain, your mood is going to be affected. So pain can actually affect mood, but it isn't necessarily the cause of it. Now, one of the things that could also happen is that if you've got pain, your mood can make your pain even worse.
Yeah.
Or a controlled mood can actually control your pain as well.
Okay. And I think everybody knows that when you're in pain, your mood is usually horrible. So what are some easy ways, say you're having pain or you're in a bad mood, what are some things that now as people are sort of in their home, they can't do much, do the things that they usually do to take their mind off of their pain, take their mind out of their current situation? What do you usually recommend right now?
Well, mindfulness is an important thing. So for example, if you're taking the time out of the day to just ground yourself in the moment, that's an important thing. Another thing is to try to focus just on the things that you can control and not the things that you can't. Because if you try to focus on things that you can't control, it's going to make you overwhelmed, and being overwhelmed is going to create more pain. Being overwhelmed is going to make it more difficult to sleep. And if you can't sleep, you're going to be in increased pain and your mood is going to get affected. So simple things like watching proper nutrition, trying not to drink as much, although that's a little bit difficult nowadays, keeping properly hydrated, trying to get a minimum of exercise will definitely make a difference.
Okay. And I like the idea that you mentioned about trying not to control the things that you can't control.
Yeah.
What did somebody say? I've heard this as trying to minimize future think and try and keep yourself in the present. And that's difficult, especially when people may have stresses coming from family, taking care of kids at home, doing homeschool, and don't know if your job is around. Those are a lot of stresses. Now, do you also recommend let's say somebody is feeling maybe more out of control than they normally would, how do you when is a good time for them to come and see somebody for their pain or for their mood?
So if you are so depressed that you can't get out of bed, and or you're starting to feel like life isn't worth living and that you would be better off not being alive, that would definitely be a time to contact us right away and come into the office. Now, if you're having that along with your pain, or your pain is forcing you or causing you to have some of these thoughts, again, another good reason to at least give us a phone call to try to come in and maybe have it evaluated. On the other hand, if you're feeling just a little tired, a little bit out of sorts, if you're feeling like a little more fatigued, those may not necessarily be a reason to come in right away. But if you feel it progressing past a certain point where it's not shaking or it's staying constant, then yeah, that might be a time to come in and have a check.
Can we get and just make sure it's not something maybe worse than they realize?
Right.
I've had a few patients that postponed things that they sort of regretted postponing later, and so that makes sense. And also, especially if you are so depressed you want to hurt yourself, I do know that suicide hotlines are up like 1,000%. So it is it's a big situation. So if anybody has any kind of issues, it is very important to go and contact a professional to help out.
Absolutely. And listen, there's nothing in life that can't be solved. There's a solution to everything. There's always light at the end of the tunnel. And sometimes you just need somebody to help you talk this through. If you're feeling impulsive thoughts or thoughts of wanting to hurt yourself, don't wait. Call, reach out, get help. There are a lot of resources available, especially nowadays. And again, the key point here is the worst case scenario never happens. Sometimes our minds lead us to think that way, and then we think that there's no solution. But there's always a solution to almost everything in life. All of this, which is going on, COVID-19, the pandemic, all of this will eventually pass one day, and we'll all be better for it.
Yeah. All right. Well, thanks, Dr. Ananth, for some insights. I hope that this has helped somebody. And if you guys have any questions, please contact us. What's our best contact information?
310-437-7399 is our phone number. You can also come to our website at www.pacificpaingroup.com for more information on how to contact us and for further resources, which we will soon post.
All right. Thank you.
Thanks, Dr. Chen.
Thanks.